let's talk all about depression. Today's episode actually made me pretty shaken up after I listened to it and after the information that was shared today. My guest, who's a dermatologist, shared that 100% of his patients experience some form of depression when they have eczema. You'll even hear him talk about how what he calls the utility scores of eczema are actually very similar to cancer patients. And it just shows what a big impact this condition has on us. Even though it's not life-threatening most of the time, but it does impact us in a large way. You'll also hear him share about suicidal thoughts that people get as a side effect of eczema or even certain medications, as well as a subject that's never really discussed, which is homicidal thoughts as well. He also shared about the impact of mood and psychiatric and the impact of mood that can come up as well. He also shares about the impact that eczema and medications can have on mood as well. So you'll definitely not want to miss out on this episode. I hope it helps you today. Be sure to check out Skin Essa Probiotics. They're such a great probiotic company. I love that they produce high quality products. They even have the Good Manufacturing Practices seal stamped on their product to show that they really do produce high quality products. And they go through the extra measure to remove magnesium stearate as well, which I really love. I love that they are also backed by a clinical study that has actually shown that the blend of probiotics, this probiotic strains used in their probiotic blend actually have helped many people. So be sure to check it out. Don't forget to connect with me on social media at Eczema Conquerors on Instagram, YouTube, TikTok, and Facebook. Join my free Facebook community group and get my free ebook on my website. I hope you enjoy today's podcast.
Hi, and welcome to the Eczema Podcast, where you'll learn tips, products, and natural eczema remedies from Abby, registered holistic nutritionist and founder of eczemaconquerors.com. Stay tuned as she invites experts in the field. Here's your host of the Eczema Podcast, Abby.
Hi, everyone. Welcome to another episode of the Eczema Podcast. I'm here with Dr. Jonathan Silverberg, and we are going to talk all about the topic of depression. How does depression affect our skin and vice versa? How does our skin affect depression? And there are some very interesting stats on this, and I'm just going to read out some of them because they will affect our conversation today and also to just drive awareness about how our skin can affect our quality of life and also depression. So some interesting stats are that 1/3 to 1/2 of adults with atopic dermatitis avoid social interactions because of their appearance. Parents and caregivers of children with atopic dermatitis report feeling embarrassed about their child's appearance, as well as frustrated and helpless, sadness, and guilt. Also, children, adolescents, and young adults with atopic dermatitis feel isolated from their peers due to this condition. 1 in 4 children and teens with atopic dermatitis have experienced bullying. Half of adults with moderate to severe atopic dermatitis share that it significantly limits their lifestyle, and nearly 40% of patients with atopic dermatitis report that they have turned down a job or an educational opportunity due to their condition. I have also seen somewhere where there is an increase in the amount of suicidal thoughts as well. I'm just trying to find the stat, but I believe that I've seen that the amount of suicidal thoughts that people with eczema tend to have are about a 40% increase. Dr. Jonathan, you can correct me if I'm wrong, but first I'm just going to introduce Dr. Jonathan. He's Dr. Jonathan Silverberg. He's a board-certified dermatologist who specializes in atopic dermatitis. He's published about 350 papers now on this topic, and he does an enormous amount of research. He's also a speaker, so he speaks on this topic And we are just so thankful to have you here to share more about this topic about depression and how it affects the skin. So welcome to the show.
Thanks for having me.
So I would love to dive into this topic and get your thoughts and also your experience based on the research that you've done about how eczema can affect depression and vice versa.
Sure. So, I think you said it perfectly in the sense that it really is a bi-directional relationship where one leads into the other. I'll start with the first direction, which is how depression or stressors can flare up eczema, and then we'll talk about the other direction. There's actually less research that's been done on that first step, right? On how emotional triggers or stressors can set off the disease, but it's something that universally we see across almost all atopic dermatitis patients. And in fact, that distinction is one of the diagnostic criteria for atopic dermatitis from the Hannafin and Reicha criteria published back in 1979. So it has been long established that emotional factors really can trigger the disease. And I think what's not obvious to many is that it's not always the stressors that you think. Certainly if there's a grieving process, someone loses a loved one, that's obviously a tremendous emotional stressor. And just to illustrate that point, I had one patient that had some mild disease for the preceding 2 years, nothing too impressive. And then she lost her mother. And within 24 hours was what we call erythrodermic, covered 100% head to toe. It was so bad so quickly that I was actually contemplating, do I have to hospitalize her? And she misses her mother's funeral. That's how bad it was. So that's not something I think a lot of clinicians recognize, just how profound it can be. And maybe most patients don't get it quite that obviously, that profound light switch in a sense, but that's how bad it can be. But it's not just those, difficult stressors. Sometimes it's even good stress, so to speak. We've had patients say they were planning their wedding and it was the happiest time of their life, but it was still stress. And that was enough to flare up their eczema. So, stress comes in all different shapes and forms. And obviously there's work-related stress and home-related stress and relationship-related stress. There's a lot of different things. And it's not always easy. In fact, it's almost impossible sometimes to avoid stress. But it's important for patients to recognize that connection, because if they're going to be in a stressful situation and they know it, then that may mean that's a period of time where we have to step up therapy. And, we have to be a little bit more aggressive to get them through those kinds of stressful periods. And then once hopefully the stress goes away, we can ease off and they don't have to be on those kinds of medicines lifelong. So it is an important concept to recognize. Now, the flip side is really, I think, I don't know if it's the more provocative one, but it's certainly an important one nonetheless, which is that we see with eczema, with atopic dermatitis, the more severe it gets, the more mental health symptoms there are, period. And I say it that way as mental health symptoms because this is an area that has evolved. It's not just randomly they have major depression or randomly they have generalized anxiety disorder. These are symptoms of depression and anxiety that track literally one-to-one with the severity of the disease. So I can look at a patient and I can say, okay, this is the intensity of their itch. This is how extensive their disease is. I can almost predict they're going to have depressive symptoms because it is part of their disease. We don't fully understand why. It might be in part because of the sleep disturbance. It might be in part because of fatigue, self-consciousness. But there are some who have suggested that it may even just be some of that inflammation that's floating around in the blood and how that impacts the brain. And there may be something to it, but we certainly need more research to understand some of this. But this is something that happens almost universally. And in the really tough cases, that was one of the really provocative studies that we published a couple of years back, a study called the Atopic Dermatitis in America study, which was a population-based study of adults in America. And we found that amongst those who had severe itch and severe atopic dermatitis severity scores, 100% of them, but every single one, had probable anxiety and depression, right? So That's provocative. It's rare in medicine you ever see anything being 100%. But that is how common it is. And what we've learned is for many of those patients, they don't need to be treated with antidepressants. They need to get their eczema under control. I'm not saying everyone. There are some patients who might need to see a mental health specialist. But when I see mental health symptoms like that, that is a clue and a prompt for me to know, all right, this is clearly debilitating and impacting the patient. I need to step up my game. I need to treat more aggressively to get the eczema better, to get the itch better, get them sleeping better. And then for most of those cases, those mental health symptoms improve. And only in that minority, when they don't improve, will I then say, okay, we'll need to see a mental health specialist, or we'll consider, additional treatments for that. So I think it's a really important concept. And in truth, it becomes a cycle, because if patients really have bad eczema and they're stressed out about their eczema, that stress will actually flare them up even more sometimes. So it becomes, unfortunately, a vicious cycle sometimes.
That is really, really tough. And I can attest to that is something that I experienced as well. Just having mental breakdowns every few days. And then as my skin got better, it was every few weeks. And then it slowly started getting better where it was only every few months. But yeah, now my mental health has improved so much that my skin has gotten better. But you also hear cases on the news where some people had suicide over it too. And one story I read was in Hong Kong where one woman, or she was a daughter, I think she was studying a lot for school, and she somehow murdered her parents and then killed herself as well. And that was just a really, really sad story.
Yeah, I'm familiar with that story because it was covered, unfortunately, on the news. And it's the kind of thing that it's provocative to the media, because you would never think, right? It's just eczema, right? How could that be? Yeah, we see this. Some of that is from the eczema itself. Some of that can even be from the treatments. So I had one patient that, she came in with her husband. We were talking about treatment options. And, she mentioned that every time a doctor would put her on prednisone, which is systemic steroids, she would become homicidal. And when she first started it, she would tell her husband and her kids, get out of the house. I don't want to hurt you. So, and that is a side effect of systemic steroids. Rarely, but it happens. So I think, it's a complex situation, because we have to be careful that the treatments we use are safe and don't cause these kinds of mental health issues as well. But we have seen this. And suicidal, there's a big difference, right? There's a lot of nuance even when we talk about suicide. So there's having suicidal ideation in a very generic sense, right? Senses of guilt, or perhaps a sense of despair, like, I almost wish I weren't alive to have to deal with this. And no one should ever have to experience any of that. But that's one level. Then there's what we always worry about in the mental health world of, does a person really thinking about a plan or something along those lines? And fortunately, that's less common, but that happens. And that's something that we have to obviously worry about and monitor more closely. And one of the challenges of suicidality is that, and you're correct, there are a number of studies that have looked at suicidality. There are a couple of different, what we call meta-analyses, that have sort of pulled all those studies together over time. We published one, another group published one around the same time. And it may actually be even more than that. When we looked across all the studies, it was about 6% of the non-atopic dermatitis population that had some suicidal ideation. In the atopic dermatitis patient population, it was about 12 to 13%. So it's almost double those rates. But, it's something that it can happen even in patients who are not depressed. And that is something that we've learned from the world of psychiatry and neurology. Most people think, suicidal ideation only happens when someone is depressed or shows those classic symptoms or signs of depression. It's not actually true. And there's a small subset that can be suicidal even without depression. So there's definitely reasons why we want to be screening for this and monitoring for it. And again, it is a reason for me when I see this stuff pop up to say, okay, this is clearly more debilitating than the average case, and I have to be more aggressive and careful how we manage this. But I've had multiple patients with really bad disease who have had attempted suicide and have had to deal with that. And I just have one one anecdote, one case where this was a patient who twice attempted suicide. And even after that, when we were trying to get some of the newer therapies covered to get better control of the disease, their insurance company were still jerks about it and wouldn't cover it, to the extent that it had, the family had to sue the insurance company with a state insurance for it. I mean, so it can have this toll and yet still go unrecognized. And, in one of the studies that we did looking at symptoms of depression and anxiety, what was really remarkable was that amongst those patients who met all criteria for major depressive disorder, about 40% of them went undiagnosed. So it's not just that they have higher rates of it, but it's not being recognized by their doctors. And that's obviously a concerning situation because we know how problematic mental health symptoms are and depression can be for patients.
Wow, those stats are really, it's just so tough to hear. And that's really crazy how you shared that you've had patients who have been on systemic steroids and they have had those homicidal thoughts as well. So when it comes to that, what do you do if they are on steroids and then they have thoughts of either suicide or homicide? Yeah, what are the options?
Yeah. I mean, first, it's not simple, right? Because you have to be careful with systemic steroids to begin with. If you stop too fast, then it rebounds and makes the disease even worse. So for some patients, they've had to have a brief stay even in a mental hospital or try to get, urgent follow-up either in an emergency setting, urgent care setting, or in an outpatient setting for someone to watch over them carefully, prescribe appropriate therapy, monitor appropriately. And it depends on obviously the level of acuity and how bad it is. But that's one of the reasons why I almost never use systemic steroids, because even though it's not happening in all patients or even most patients, I don't even want to take a chance that's going to happen in one patient. And I think it's just a testament to the unmet needs that we still have, that we need strong therapies, but that are safe. And fortunately, we have a lot of things under investigation right now for tougher cases of eczema and even for milder cases. And these are very welcome additions. But I try to stay far away from systemic steroids for exactly this reason. I don't even want to have a chance that the patient has to encounter this kind of stuff.
So Dr. Silverberg, can you share the difference between what systemic steroids are compared to topical or even oral?
Sure. So when we talk about systemic steroids, we're talking about either oral or injectable steroids. And even within the injectable realm, there's the kind that can be given IV, and there's the kind that they'll give an injection usually in the butt or subcutaneously. And there's differences between them, but the highest risk probably by far would be the IV ones, just because it's such high doses. And that's usually done only in the inpatient setting, hospitalized patients. The oral steroids are probably comparable to the injections into the backside, but they come with some real side effects. Now that's different than the topicals. Now, and actually, I should be careful when I say it may not be so different. In fact, one of the topicals that we use very commonly is one called triamcinolone. That's also one of the ones that can be injected. Same name, but the way it's administered changes everything. When we put that on topically, you're talking about, minuscule amounts of absorption internally, right? So yes, there may be some absorption, and it's something that we have to be careful about and watch for. But really, generally speaking, you have less than 1% of any of that medication gets into the bloodstream and causes any side effects. Whereas 100% of what's injected or what is taken orally is going to absorb and cause those things. So we don't have the same level of concern. So there's other side effects we have to worry about with topical steroids in terms of thinning the skin or atrophy issues. And that's true for the systemic steroids as well. But I have not seen or heard of any cases of this kind of suicidal ideation or depression caused by topical steroids. Whereas, again, with the oral steroids, which are used in so many different areas of medicine, this is something that is not common, but well established as a side effect for those systemic steroids.
Wow. That's very fascinating. I took oral steroids for a while when I was younger. I did definitely have suicidal thoughts as well. So it's just very interesting. It's just bringing a lot of things into light about how both can actually be tied together, where not a lot of people are aware of that. So do you see a lot of patients who do get an eczema flare-up either from, you mentioned someone had a death in the family, so either that or from divorce or even just from a dating breakup?
Sure. I mean, those are obviously, very emotionally traumatic events in any setting. And so, it can become a major stressor for anyone, but certainly for someone with atopic dermatitis. And for some patients where they're already struggling to keep up with their atopic dermatitis, adding on yet another negative effect of their atopic dermatitis just can be so demoralizing. So absolutely. I mean, look, we've had patients where these issues come up. And that, look, it varies by how much of an emotional support system the patient has or doesn't have, right? And that's true for anything in mental health in terms of stressors. But it's something that, these events are definitely going to compound things and make it worse. But from what we've seen with some of the studies with depression, it doesn't even have to be these major traumatic events. It can just be the day-to-day stress of the eczema and just part of living with eczema on an everyday basis that can be associated with depression as well.
That's so fascinating. Thank you for sharing that. I bring that up because my eczema first flared up when I was in my teens, and then I went through my first breakup. So that was when the biggest flare hit me. But I also spoke with someone recently who said she came out of a really long relationship and she went through a breakup, but her eczema actually cleared up. So I found that really fascinating how it was the other way around.
Yeah, and look, sometimes there are toxic relationships and stressful relationships, and sometimes, I've had multiple patients with this come up. I have one patient that comes to mind in particular who was married for over a decade, and it's not like a bad marriage caused the eczema, right? The eczema was there for decades, longer before that. But all of that marital stress and stress in the home was aggravating the eczema. And then she eventually, broke up. They got divorced. And she was so happy because her eczema actually wasn't flaring as much. And I would never recommend a divorce as a therapeutic strategy. But it just points out that sometimes when there is a toxic relationship, and this can, you can apply this to many circumstances, not just in the home, right? It can be in the workplace. If there's a job setting where it's just too stressful and they're not supportive and they're not understanding of a patient's needs because of their eczema, then, I will have a conversation with the patient, say, well, maybe you want to consider a different workplace. And of course, that's a very sensitive topic. But it's something that, you want to find strategies to minimize that stress. And look, some patients say, look, I love my career. I love my relationship. Even if it's stressful, no matter what, I want to keep going. Okay, then we'll treat through those issues and try to make sure that at least they're not going to be itchy and having all these quality of life issues and mental health issues. But for many patients, they'll say, what do I need this for? Why am I going to be on lifelong medication with potential side effects when all I have to do is avoid this particular stressor? Not everyone can do that, right? It all depends, and every patient's different in terms of what those stressors are. But I've had patients who said, look, I had a good career and I'm walking away. I'll change because why am I going to be on a cyclosporin? Why am I going to be on some potentially toxic medication when I can just do early retirement or change career paths? So it happens on an individual basis. But as a doctor, I'm not going to recommend that as the only option. I mean, maybe I'll have that conversation on occasion, but it's my responsibility to try to allow them to do everything that they want to do and still not flare up, and at least give them those options.
Thank you for sharing that. And I'm glad that you also consider the stressors in their everyday life and not just treat their skin. And I think that's really important. And I have had places in my workplace where my boss was really just stressing me out and it just flared up my skin. And I've had a lot of times where I just, walked away from that job and my skin cleared up. So that's been really helpful. And I know that we're a bit short on time, but is there any last words that you want to share? Any interesting stats or either any last words of advice or encouragement that you want to leave people?
Yeah, so I think there's definitely a lot of encouragement. I know sometimes as patients hear some of these stats, it's a little depressing in a sense just to hear about the depression stats. And I think, one, it's important to recognize, first of all, not everyone has these. Two is, I think it's super important for patients to always understand this does not make you crazy. This is not, when you think about how we classify mental health disorders, this is not major depression or major depressive disorder. This is depressive symptoms of eczema. And that is why we have to work, harder on getting the eczema under control for so many patients. Fortunately, there's a lot of new things coming. There's a lot of development. There's a growth in our understanding, and that's important. And doctors are starting to be tuned in more to this. I think it's something that you should bring up with your doctor. If it's something that's impacting you and you think that the poor control of the eczema is doing this, bring this up with your doctor, because that's a reason for you to be a little bit more aggressive with treatment. And I will tell you, even in terms of how we pay attention to this in clinical trials, many, if not all of the clinical trials that are out there now, are starting to pay attention and are looking at these different patient-reported, outcomes and tools for measuring symptoms of depression. And that's going to be an important aspect of how we know how well a drug works, is how does it improve that overall mental health, quality of life, etc. So I think that's a very, it's very positive, actually, and things are heading in the right direction in that respect, which is great to hear. And then just one other point that I would throw out there, maybe unrelated to or related, but a little bit broader than that, is actually there is a conference that I chair called Revolutionizing Atopic Dermatitis, which is all about that multidisciplinary aspect of eczema that takes into account the mental health, the sleep, all these other aspects, the allergies, etc. And so we're going to have our next virtual meeting in December, on December 13th and 14th. And we can, for any patients, the registration is not fully open yet, but for any patients who are interested, you can even pass along my email information. We can even just get them in and either discount or waive the registration if they're interested in attending.
Thank you so much. That's really amazing. And I appreciate you that you're chairing this conference and just spreading awareness for this condition. Thank you so much for everything that you're doing. And if patients want to come see you, where can they find you?
So I am currently in Washington, D.C. at George Washington University they call it the Foggy Bottom campus. And we do Zoom visits now also because of COVID. The whole world has changed. And if I can be of help, I'm happy to. But that's where you would find me.
So can you only see patients in Washington?
No, although there are some restrictions across state lines with insurances and stuff like that. But I have seen patients from multiple states doing this virtual approach. But there's definitely, as telehealth grows, we're starting to see where sort of like the pressure points are. And it's a challenge for government to figure out how to take these roadblocks down. Because, it's unrelated to everything we just talked about, but, all of rural America is cut off from specialty access because it's just physically so far away. So I think telehealth will eventually adapt, but we definitely should be able to see most patients, at least I hope so. And, I don't know about the insurance issues, but legally we can see most of those patients and address those issues.
Awesome. Thank you so much, Dr. Silverberg.
My pleasure.
I really appreciate your time and everything else that you're doing.
Thanks for listening to the Eczema Podcast, and stay tuned for our next episode. If you like what you just heard, we hope you'll pass it along to your friends. Visit eczemaconquerors.com for more articles and tips. Thanks for listening.